And then another one, especially with tennis, I think is higher level balance. You know, some exercises that we call proprioception exercises. You can start off very basic, where you are just standing, maybe with your feet staggered, maybe even where your toes and your heels are matched up together, and you're just working on trying to balance this way. This may be very difficult for some people. If this is easy for you, then maybe what you do is you eliminate one of your balance systems, which is your vision. We rely heavily on our vision for our balance, and if we eliminate that, we really force ourselves to utilize our proprioceptive system.
So you mean shut your eyes?
Yes, so if I'm standing like this with my eyes open and this doesn't really challenge me, then I could do it with my eyes shut, and I might find that I don't have as good a balance as I thought I did. When that doesn't challenge me anymore, we can go to something like standing next to a countertop or holding onto a chair and actually standing on one foot. And I would start off initially with my eyes open, and then eventually I would try to do it with my eyes shut.
With your hands on the counter or taking them off?
Well, I would start off with my hands on the counter just so that I had the balance, and then once I was there, I would see if I could just hover my hands over top of the countertop, just so that if I need to grab it for my balance, I could do that. But the idea is to be able to balance on one leg initially with your eyes open, and then eventually your eyes closed. And so just to kind of summarize... go ahead, I'm sorry.
So you mentioned hip strengthening. What about like quad strengthening or core strengthening?
Absolutely. So so with quad strengthening, you can do some basic exercises where what we call a quad set, where you're just lying in a bed or on the floor, if you can do that, or on a mat table like what we have here. But you're working on pressing the back of the knee down. And when you press the back of the knee down, you should feel your thigh muscles tighten. The other thing you'll notice is that when I press my knee down, my foot kind of pops up in the air a little bit. I show that to you because some people, when they try to do this exercise, they kind of dig their heel into the mattress. And when you do that, you're using more of your buttock muscles to do that. And there's nothing wrong with that, but we want you to strengthen your quad muscles. So you're pressing the back of your knee down. Maybe you feel your foot pop up in the air a little bit. You hold those muscles tight for 3 to 5 seconds, and then you gently release. So that would be one way to do it. Other ways would be where your feet are in contact with something. So maybe squats or single-legged squats. You know, I think it's very important to isolate your legs, because a lot of times I have patients who have one leg that's stronger than the other. And when they're doing both legs at the same time, the stronger leg always compensates for the weaker leg. So if you can do something like a single-legged squat where you're coming down with one leg and driving back up again, maybe you have a chair or something that you can hold on to for balance, I think that would be a wonderful thing to do as well. Core strengthening, a real basic one, would just be planks. Most people know what planks are, but you know, once again, a mat table, a bed might be difficult for this just because it might be a little bit softer, so usually a firmer surface would work out well. But if you can just get to where you can prop up onto your elbows and up onto your toes, you're trying your very best to kind of keep your body straight, and then see how long you can hold that. Usually if you can hold that anywhere between 30 seconds to a minute, give yourself a break and maybe repeat that a few times. That would be a real good way to strengthen your core muscles. And boy, I really think that would be extremely beneficial for a tennis player to have much better balance, much better core strengthening, which would include their hip strength, hip muscles as well. Obviously, you want to have good flexibility. All those things would be something that would be extremely beneficial for a tennis player.
Thanks, Scott. I think that was very helpful. And as always, when my patients get sent to physical therapy, I tell them they might have some knee discomfort when they're doing some of these exercises, but don't be alarmed. They're certainly not doing any damage to their knee. And I think that's very good insight today, Scott. Thanks.
You're welcome.
If you liked this video and found it informative and would like to have further information, please check out our YouTube channel, as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.